Shipman, the Manchester family doctor, was found guilty of murdering 15 of his patients, all of them women. He is now the biggest convicted killer in recent legal history.
Harold Shipman was born into a working-class family and was seen as a young bright kid. As a child, he saw his mother receive morphine injections to ease the pain she had gotten from lung cancer. During this period, he became interested in medicine and later on got a medical degree from Leeds University. A few years later, Harold Shipman became a general practitioner in Todmorden in Lancashire, in which he was found to have written fraudulent prescriptions of petidine. He later got addicted to the drug, which forced him out of his practice and led him into a rehabilitation center. In 1977, after exiting the rehabilitation center, Harold managed to find work as a general practitioner in a small town known as Hyde. At this place, he managed to gain respect and was seen as a reliable practitioner. During 1988, one of Shipman's patients was discovered dead within her home only hours after being visited by Dr. Shipman. The family was devastated by the death. It came all of a sudden. What Shipman had done would make the family of the deceased patient question him. He had managed to forge her will, which made him entitled to her property with a value at around £400,000. And by Shipman's insistence, no autopsy was needed. The English government started an investigation about how many people had given the will to Harold Shipman, and most important of all, how many murders Dr. Shipman had committed and how long it had been going on for. During the year 2005, the government had created an official report that stated that Harold Shipman had committed over 250 murders on his patients beginning all the way from 1971. All of them were considered old. It had been found that the way he killed his patients was by using a lethal dose of the painkiller called diamorphine, which he injected into his patients. After killing them, he would sign a death certificate, making it seem as if they had passed away due to natural causes. In the year 2000, he was found guilty on 15 counts of murders and 1 count of forgery, which led him being sentenced to life in prison. But he never had the chance to spend time in prison because later on he was found dead in his cell by hanging. He had committed suicide. The suicide shocked everybody. Nobody saw it coming. There was never any clear meaning behind the killings, but there were a few motives. Some experts suggested that he wanted to avenge the death of his mother, who passed away from lung cancer, or that he wanted to remove the old people from the population as he saw them as a problem for the system. It might have even been that he felt a rush from having the power as a doctor to decide if the patient was going to live or die. The motive will forever be unknown, and the families of the murder victims would never get a clear answer.